Batswana betso ke di dumedisa ka pula pele ga ke bua le lona ke kopa gore re tseye motsotso wa timalo go gopola ba re tlogetseng ka ntlhang ya COVID-19. Amen. Bagaetsho, I come before you as I usually do to provide an overview of our COVID-19 response. As you will recall, when I last addressed you on the 13th of August, I indicated that the Delta variant-driven surge that was upon us necessitated the introduction of 3 weeks of severe restrictions that were implemented to reduce transmission of COVID-19 and accelerate our vaccination program. In this regard, I wish to share with you progress made thus far. As a result of our compliance to these restrictions, we have seen a gradual decrease in the number of new infections and deaths over this period. As at the 14th of August, we had 13,380 active cases, translating to more than 1,000 cases per day, with a positivity rate of 27%. By the 30th of August, active cases had dropped to 5,146 and daily cases halved, with a positivity rate of 9%, nearly a threefold decrease. We have also witnessed a significant decrease in hospital admissions, with a 70% decline in patients admitted into our COVID-19 treatment facilities. Government has embarked on an exercise to capacitate hospitals in an effort to decongest 𝐏𝐾𝐒𝐈𝐒 Teaching Hospital and also provide a middle corridor for referral of patients who need higher level of care. This capacity for the provision of oxygen concentrators, oxygen plants and critical care equipment has improved across the country. Basic care has also been expanded through a strengthening of community home-based care program. The second objective of these restrictions was to accelerate the vaccination campaign in line with priority number 1 of our reset agenda. I am happy to inform you that to date, the country has managed to fully vaccinate 21.6% of the currently eligible population of about 1,531,000 people. As of August 2021, the country embarked on a second phase of the vaccination plan, targeting individuals aged between 30 and 54 years, starting with those aged between 45 and 54 years, due to the limited supply of vaccines. In spite of this limitation, and in recognition of the impact that COVID-19 has had on all sectors, frontline workers, including those in the education sector, among others, were prioritized in phase 2 of the vaccination plan. 1,009,974 doses comprising Sinovac, AstraZeneca, Johnson & Johnson, and Moderna are expected to be delivered during the month of September. This number includes the 404,494 doses of Sinovac due to arrive this Sunday. The total number of vaccines expected this month, together with those that have been received so far, will mean that by the end of October 2021, 975,782 Botswana will be fully vaccinated, translated into 64% of the target population being fully vaccinated. Allow me to take this opportunity to emphasize and remind all Botswana that it is important for everyone to receive all the required doses for them to be fully protected. Bagaetsho, in view of the declining number of cases and deaths, government has taken the following decisions, which will effect from 6th September at midnight. The curfew will start from 10 p.m. to 4 a.m. All public gatherings, including khotla meetings, merapelo, weddings, patlo, and magadi, will be reinstated while following COVID-19 health protocols. The number of people at religious gatherings and church services remain at a maximum of 50 people, and such gatherings and services be held twice a week. Funerals be conducted within a period of 5 days from date of death and should continue to follow all established COVID-19 health protocols. Interzonal movement continues to be restricted to essential travel only. Schools will be reopened as planned, and the ban on the sale of alcohol will be lifted and allowed on a takeaway basis as per level 3 of the emergency response framework. Batho ba gaetsho, even as we ease these restrictions, we should be cognizant of the recent detection of a new C1.2 variant in Botswana. This new highly mutated variant could lead to a resurgence of new infections, which could possibly usher in the fourth wave. I therefore urge you, each of us, to take responsibility to protect yourselves, your loved ones, and the nation by continuing to wear your masks appropriately, washing your hands with soap or sanitizing, maintaining social distancing, and avoiding unnecessary travel. Let your health and life come first. Pele ga ke leboga, allow me to state that this government that I lead is fully and completely anchored on the Constitution of the Republic of Botswana. It is a democratic government, as I and my whole team are. It is subservient to the people it serves, and therefore it would always want to ensure that which everyone is entitled to by way of rights, privileges, and responsibilities. In this connection, I want to inform the nation to ready itself for exiting the state of public emergency at the expiration of the current one on 30th September 2021. I urge and pray that we all have it in us to protect ourselves and each other for the sake of our survival and prosperity. This is a necessary condition for us to realize the ideals of Vision 2036. Apulaene.